Right, good morning Queensland, and good morning to all of our Facebook Live followers as well. Welcome, and it's a beautiful day here in Queensland. So we're standing on the site of where our new performing arts complex is being built, but we'll be talking about that a little bit later. I've got the Arts Minister and John Copsis to come here and talk about that. But let's give the COVID update first. So in more good news today, we have 11 new cases, but 10 of them are all linked to the Indooroopilly cluster, and they're all in home quarantine. So that's fantastic news. And one person was detected in overseas in hotel quarantine from overseas. So that's fantastic news. We're very happy with that. And we were expecting to see that increase in numbers because people are getting tested on day 10 and day 11. And we do expect to see similar numbers over the next couple of days as that cluster keeps progressing through and having their day 12 tests. We have 15,334 people in home quarantine. We have 155 active cases. Great news, over 31,000 tests in the past 24 hours and 3,341 tests in Cairns. So that's fantastic. And thank you very much for the residents in Cairns for coming out. And please, Queensland, remember, if you have any symptoms, it is absolutely imperative that you go and get tested. So please keep that up. That's fantastic. 16,226 vaccines were administered by Queensland Health in the past 24 hours. And the vaccination centre yesterday went really well. We were out there yesterday. 1,465 people received their vaccine. And we have, over the last 3 days, 116,000 people have registered with Queensland Health to get their vaccine. So that's, again, really, really good news. So can I just say to the families that are in home quarantine, and some people have questions about once they receive that negative test, what happens? Can you please contact your school, the school that your child goes to? They will have all of the dates that are applicable to your particular child. But if you have any questions whatsoever, please ring 134 COVID and Health will give you some further advice as well. So please, there's a lot of questions out there about when people can leave. It's important they stay for the 14 days. So just because you receive a negative test doesn't mean you can leave your home. This is very important that people do not leave their home until they have checked when they can. So that's absolutely critical. And I do want to thank the public for doing the right thing. Everywhere where I've been out, I've seen people wearing masks. And of course, to all of our high school students, I know it's been a hard adjustment, but thank you very much for what you've been doing there. Okay, so just about some other issues across the nation. So in relation to South Australia, as of midday, anyone from South Australia will be able to leave their home quarantine as long as they have a negative test result. And of course, we'll be opening up to South Australia as well, but you have to fly in. You can't drive through because of the situation in New South Wales. With Victoria, they are extending their lockdown, so all the restrictions about Victoria remain. Now, I want to say this to Queenslanders, especially to Queenslanders on our border with New South Wales. We are very, very concerned about the situation in New South Wales. What we are seeing now is more of these regional communities close to the Queensland border, especially out in the southwest area, are now going into a period of lockdown. We are very concerned. The Deputy Premier and I will be having a phone hookup with our mayors along those border communities just to reinforce to them that no one should be crossing that border to go into New South Wales at this stage. Can I say to Queenslanders who live on the Gold Coast, New South Wales border as well, or to any Queenslanders in southern parts of our state, please do not cross into New South Wales. We will be monitoring this situation extremely closely over the next 24 to 48 hours. We do not want to see this virus creeping north, and if we have to implement harder measures, we will. So I'm please urging Queenslanders, do not go into New South Wales. Of course, we have those essential workers that have to, but now is not the time to cross the border and do your shopping. Please stay within Queensland. And also too, we'll be talking, health is at the moment talking to those mayors, and we'll talk to the mayors as well about actually increasing our vaccination to the Queensland communities that are on that border. So very, very concerned about that, and I'm quite sure that this will be an issue that'll be raised at National Cabinet tomorrow as well. So anyway, stay safe everyone. Keep up that great testing rates in Queensland, but also too, that check-in app is really, really important. So just a reminder to make sure that you are using that check-in app when you are going to cafes, restaurants, out and about with your daily routines. And to all the people in home quarantine, you are heroes. Thank you so much for what you are doing. If you weren't staying home, you know, we don't know what would have happened. So thank you so much. And as we see, whole households are actually testing positive with this Delta variant. So they have done a mighty job, and I'm really, really proud. So I'll hand over to Dr. Young.
Thank you, Premier. So we now have 130 cases related to that Indooroopilly cluster. So thank you to every single person who's been in home quarantine due to that cluster. You have absolutely kept Queensland safe. Some of you have still got a few more days to go. Others are coming out of quarantine shortly. If there has been no one in your household who's tested positive, so you don't have any of those 130, and everyone in your household has had a negative test at day 12 and you've completed the 14 days, you'll be able to leave, but not any earlier, please, because we're still seeing cases pop up towards the end of that incubation period. That's really, really important. So just stay the distance. It's not too much longer, and it would have been really tough to continue with that. So thank you very, very much. So it's really important. We are going to see more outbreaks. So this was our 15th incursion of the virus in the last 6 weeks. It was the 15th outbreak that got away, and we ended up with 130 cases. Now we are going to have more outbreaks. So please, anyone anywhere in Queensland, any symptoms at all, come forward and get tested immediately. You first have symptoms. That's critically important, so that we can get on top of these outbreaks as quickly as we possibly can. Now, we still do have restrictions in place here in the southeast corner and up in Cairns until Sunday of next week. So we've still got another 10 days or so. So it's really important. I know they are an awful pain in the neck. These masks, I hate them. I can't see what people are thinking. I find them so hard. They are so against our normal culture. But boy, they work. They are so effective. And thank you to every single child at school who's wearing them. You are going to prevent the next outbreak in a school by wearing them. And thank you to the teachers. I can't imagine how hard this must be for you, wearing masks at school all day, every day. Just the strain on your voices, the difficulty communicating. It is really hard work, but please, we just need to persist, and hopefully we'll be able to remove that mask requirement Sunday week. We'll see how we go, and I assure you that the minute we can remove the requirement to wear masks, I will be advising the Premier we can remove them. I don't think we wear them just in case. We wear them when we need them. But when we need them, I really and truly need everyone to wear them. And please use the QR codes, because it makes it so much quicker. Part of the reason we succeeded with this school outbreak related to Indooroopilly, to those schools, is because the schools knew who all their students were. So we could get them into quarantine so quickly. And that's how we succeeded. So if you could please all use the QR codes every single time that you go anywhere, because that means we can find you really, really quickly. That's just so important. And then the last one is please get vaccinated when you can. So register. We've had over 100,000 people register in the last few days, which is excellent. And we'll be able to pull people forward and fill up every single booking slot. I don't want there to be a single vacant booking slot anywhere in the state that we could have used for someone to be vaccinated. And as the Premier said, we're going to do a really solid push in those border communities out in the western part of the state to really push that people who live on those communities, that they get vaccinated, because that will protect those people and will protect Queensland as well. So all of these things are so important. Thank you for going ahead with them all.
For the rest of Queensland, the case data today is really positive. All linked, all in home quarantine for their infectious period. But we should remember that for the households of those positive cases, this means an extension of their quarantine, and we want to thank them for what they're doing to keep us all safe. As you've heard, we're concerned about the ongoing creep of cases north in New South Wales towards the Queensland border. Throughout the pandemic, we've worked with border communities to address their unique circumstances and ensure that they can move around their communities. We'll spend today working with their mayors to ensure that we can strengthen those border protections to stop those cases coming across the border, stop the risk of those cases coming across the border, as well as bolster their vaccination rate. They're the two best defences we'll have available on the border.
Well, it's great to be able to welcome back people from South Australia into Queensland, but we remind you that you are to travel by plane because we cannot have people driving through New South Wales. You will not be eligible to cross the border by road. So we're very pleased to be able to open up to South Australia. They've done a great job in managing their cases down there. Of course, our hearts go out to Victoria, New South Wales and what they're facing right now. But what we're seeing in New South Wales with the numbers in ICU and the number of people in their ages who have passed away, it is a reminder to everyone who is 60 plus in Queensland. There is absolutely no reason for you to not be coming forward and having a conversation with your GP about getting vaccinated. We don't want to see people in our ICUs and dying who could have been vaccinated but haven't taken up that opportunity. And thank you to the 116,000 people who have registered over the last 3 days online for a booking slot with our Queensland Health vaccination centres. So thrilled to see so many people in the convention centre yesterday. Those numbers are only going to grow. And as the Chief Health Officer said, the restrictions are still in place. Mask wearing, social distancing, number of households or number of people in your households, and importantly, the check-in app. Can I say to businesses, it's not just the responsibility of your patrons. As a business, you should be checking everyone who comes in before they sit down and have a meal or a coffee. Ask them whether they've checked in, because it is so critical that we have this check-in data, so if we have any outbreaks whatsoever, we can chase them. And again, to everyone who is home quarantining, we say thank you. We will get information up on the website and through the schools as to when you can leave home, and the Chief Health Officer has gone through that criteria as well, and also making sure that you continue to get tested if you have any symptoms anywhere in Queensland. We need people to comply with these rules, and to the parents, to the teenagers, to the school staff wearing the masks, we say thank you. We know that they're not comfortable, but this cluster has occurred because it spread through schools. So we need these masks. Reminding everyone, New South Wales started with one case on the 16th of June. They're now over 6,000 cases. We can't be complacent. We must make sure we're following the rules. Thank you, Queensland. I know you're doing a great job.
Oh, no, not at all. So the cases today, one person tested positive day 7, all the rest tested positive day 10 or 11, and everyone who isn't already positive, of course, needs a day 12 test. So that's absolutely fine. But people do need to remain in quarantine for the full 14-day incubation period.
Like once they test negative on day 12, they have to wait till day 14. Do they then have to, you said they'll get info from their schools, do they have to fill out a declaration?
No,
What
no.
happens?
So there'll be information on our website, and as long as there's been no positive test in that household, remembering there are now 130 cases, not 130 households, because we know in some households every single person is now tested positive. But if there's been no positive case in the household and everyone in that household has had a negative day 12 test and day 14 everyone's well, they can leave quarantine. And there's information on our website about that, and the schools are also sharing information. Plus, people can ring 134 COVID if they've got any questions at all.
So some people are saying to us they've been told they need a letter of clearance from Queensland Health, but
No,
that's
they
not the
don't.
case.
If they've had no positive case in that household, because we've now got well over 15,000 contacts related to that outbreak.
I understand you've given them an exemption, but they have to do 2 weeks of quarantine. They do miss the funeral. Can you just talk me through your specific reasoning in that case?
Yeah, without breaching where they live, they currently all live in hotspots that are significant hotspots.
Negative though, haven't they? I know
That
you
doesn't
talked about that
matter.
earlier,
You've just heard me go through how many people are still testing positive day 10 or 11. What if these people test positive day 10 or 11 and their funeral was day 8? It's really sad. I cannot imagine the distress and the awfulness of it. That park's quite close to where I live. I know it well. It is an absolutely tragic, terrible situation. But I can't make it tragic even more by having someone go to a funeral and spread the virus at that funeral. No one would want that. It's awful. It's a terrible situation.
Dr. Young, how concerned are you about the stuff up involving the doses, the low doses delivered at Kippa-Ring?
Of course I don't want that to occur, but look, our staff have delivered millions of doses of vaccine now, and there have been very, very few errors, and they have got such rigid processes to check, double check, triple check. That's why they pick it up. And there's actually no risk getting a third dose. There really isn't. So yes, of course I don't want that to happen. And I know the staff are trying to work through how they can stop it happening. But we have seen with this massive rollout across the country that errors have been made. But as long as those errors are picked up, and they are being picked up every single time, no matter whether it's be in an aged care facility where the Commonwealth has delivered it, in a GP surgery, in one of ours. So people can be assured that we will manage it so it's absolutely safe.
One of those 66, that they're quite distressed, understandably.
Of course they are.
They're a bit taken aback with what they perceive to be a lack of advice. They're
Sorry,
not
I can't
I know,
hear you.
I can't
Sorry.
hear you either. A bit of a perceived lack of advice from their perspective at the moment so far. Do they go talk to their GP, or do they go straight back to a hub and get their third dose of Pfizer?
They go back, and Queensland Health will work with them. So they still, if it was the first dose that they received, they'll need a second dose at 3 weeks and a third dose 3 weeks after that. If it was the second dose they received, then they'll need another dose in 3 weeks' time.
Given the number of incursions that we've had in the last 2 months, do you think we'll ever return to the restrictions that we've had before Delta came?
All I can say is that as we continue to see these incursions of the virus, each time we'll respond really fast, because we know that minimises the length of time we have to put in place any restrictions. And please, if people could get vaccinated, because the modelling shows that once we get to 70% of the eligible population, that's 16 years of age or older, we won't need to have the same restrictions for everyone. And then once we get to 80% of the population, we'll be able to pull it back even more. So vaccination is what will make the difference.
Young, South Australia is making the Olympians quarantine for 28 days. Is Queensland doing that?
No. So we've never ever required people to do double quarantine unless when they've done the original quarantine in another state, they then go out into the hotspot area. So unfortunately we have had some people who've quarantined in Melbourne and then while Melbourne was a hotspot, and then gone out into the community in Melbourne. So then they've had to quarantine again when they've come to Queensland. But we make it very, very clear to people that if you go straight from where you've done your quarantine in Melbourne or Sydney or in another state and travel by private means, so not in public transport but by private means, to the airport and hop on a plane and come straight to Queensland, we don't require you to do a second round of quarantine. But if you have gone on a shuttle bus through the community, or you've been out into the community, then unfortunately when you come to Queensland, because you've had that interaction with someone who's possibly got COVID, you need to go and do a second quarantine. It's applied to very few people because most people have followed the requirements.
How's that been done?
It's good. Yeah. So we already have done a lot of vaccination in those border communities down in southwestern Darling Downs. I've now gone and asked them to really do their best to complete it so that everyone gets the opportunity in those communities to get vaccinated who's 16 years of age or older.
These Pfizer doses to those areas. Do you have a number?
No, I don't have a number.
And how concerned are you about the shortage of nurses? Is that causing a problem? The Nurses Union says there's a shortage of nurses available to help with these mass rollouts. Is that true? Or?
It'll help enormously once these quarantine requirements end for the Indooroopilly cluster, because there are quite a few nurses in quarantine at the moment because their kids go to one of those schools. So that will help us. But really, our nurses in Queensland have done a fantastic job. They're managing fever clinics, vaccine clinics, sick patients, and doing their normal job. So I just congratulate them. They have been brilliant. Thank you.
The New South Wales Premier has said the state will lift lockdowns once they reach those thresholds outlined by the Doherty Institute. When Queensland also reaches those vaccination thresholds around 70-80%, would you reopen the border to New South Wales even if there's a high number of cases still circulating in the community there?
Let me make it very clear that I think you'll find a lot of states are very concerned about what's happening in New South Wales. I think that's going to dominate the discussion at National Cabinet tomorrow. Now, the 70 and 80% thresholds were about Australian thresholds. So that means all of Australia needs to reach those thresholds before you can start thinking about those easing of those restrictions. So that's in the national interest. But Queensland remains very concerned about what is happening in New South Wales. We wish them all the very best. We hope that New South Wales gets on top of this current outbreak, and it is in the national interest for New South Wales to get on top of this outbreak.
Queensland reopened the border. New South Wales was really on top of those cases, but that was before vaccines. So how do vaccines change the equation when you're talking about opening those borders?
Well, that's the constant modelling that National Cabinet's getting, so I'm quite sure that's going to be a collective decision of National Cabinet, and there is no way that the other states and territories are going to put their people at risk if there are increasing numbers in New South Wales. So it's a watch and see, but at the moment we are very concerned. I mean, we now have those border communities in a lockdown situation, so we will be monitoring that very, very closely. The last thing I want to see is the virus coming in across the border to our southwestern communities or into the Gold Coast and sweeping north. So, you know, if we've got to put in place tighter restrictions, we will. That's why I'm giving a very clear message to Queenslanders. If you do not need to go across the border, do not go across the border.
Trigger points, Premier, to go harder on those restrictions?
As I said, we monitor this every single day. That's why we have meetings every day. We also have discussions throughout the day and in the evenings. This is very, very concerning.
30 years ago, the Fitzgerald report said there was no legitimate justification for taxpayers' dollars to be spent on politically motivated propaganda. Do you maintain that everything your digital team does is to inform the community?
Yes.
Okay, why then does your digital team upload things to Twitter asking Queenslanders what their favourite childhood books are?
Well, I think that's great to engage with Queenslanders in a whole range of mechanisms. And as we know, our Facebook viewers have increased dramatically. I think we're up to about 294,000 followers there. So I'd like to thank all of our followers out there. And in terms of getting our messaging out about our response to the pandemic and our economic recovery plan, we know that people turn to social media. It's interesting to see that news organisations, newsprint organisations, businesses, governments, local councils, everybody is also disseminating their information through social media. It's a great way of communicating with the public.
Total number of people working in the media team in both your office and DPC?
No, I think they've done that, and that's a whole of government. So I was actually, when I saw those numbers, I actually thought there would have been more.
Doctors from overseas here to help with shortages. How much money of taxpayers has been spent on business class tickets so
Look,
far?
I don't have that information. The health minister can have a look at that. But as we do know, we have communities out in the west, in regional communities, that need to make sure that they are providing adequate services to families, and that does require time to time to get an influx of doctors, professional doctors, in those specialised fields to come in from overseas. Every state and territory, I believe, would be in that situation. And Queensland's such a decentralised state. And from time to time we hear issues about people wanting more maternity services out in the bush. Well, we need to make sure that we get the doctors out there to provide those services to all of Queenslanders.
The High Court today's refused to hear one of the final cases for the Murray-Guffin family who were living out in Billawheeler before they had that.
The Billawheeler family,
the 4-year-old.
Does that now mean that immigration minister needs to exercise his discretion to allow them?
Look, I have been solid on this. This is a family that is known to the Billawheeler community. They've lived in Billawheeler, and I believe they should go home to Billawheeler. All right, so we might now, last one, then we might move on to that.
We're confused about the border pass, the new border pass. As Steve Gillespie said the other day, he'd clarify it. It might be a Cho question, but where do they need to go to find out what
I think Steve's back tomorrow, so we might just clarify that tomorrow, if that's all right. Yeah, that's great. Okay, now we just might move on quickly, because I know people are in the sun and it's quite warm. We all should bring hats next time. But I might just bring John and Leanne in. So just briefly, we're here at the site of the brand new Performing Arts Complex, where our government's put in $150 million. The total package is $175 million. As you can see, we've got construction workers on site, over 130 people. This is a good sign that the economy is continuing to grow. And we hope that when this is finished in 2023, that our life, people will be vaccinated, people will be able to go back and enjoy the arts and the theatre, but it's something that the Brisbane and Queensland community has been after for a long time. So I'll hand over to John and Leanne to briefly talk about this, but it's absolutely, you can see the designs, it's state of the art. It is going to be a signature piece of architecture when it's completed. It complements the existing QPAC footprint, and I know it's going to give hundreds, if not thousands of families joy and entertainment over the years. Okay, Leanne.
Thank you, Premier. And of course, behind us, as this building comes out of the ground, it becomes a beacon of hope for the arts industry and of course for Queenslanders into the future. As we get ready for the Olympic Games in Brisbane, we're also getting ready to expand in terms of our arts industry. We know that arts has been hit very hard in terms of COVID-19 restrictions, as you'd expect. That's why we have committed some $79 million, including a $22.5 million arts and cultural recovery package, more than $7 million for the live music venues, and multiple other projects to be able to support the arts and creative industries in Queensland. But this building, this brand new 1,500 seat state-of-the-art theatre, will make this complex, the Queensland Performing Arts Complex, the largest in Australia and potentially the largest in the Southern Hemisphere. This theatre will mean that we can attract more musicals and other stage productions, as well as supporting our home companies, which include the Queensland Symphony Orchestra, Circa, of course Queensland Theatre, Queensland Ballet and Opera Queensland. All of this means that we can continue to grow as a centre for arts excellence in this country. We know that the arts and the industry itself contributes more than $100 billion to the Australian economy. And Queensland wants to get our piece of all of that. That's why we continue to support the arts in Queensland, and that's why this $175 million theatre that's being built right in the middle of a pandemic means that we have our confidence in the arts, and that we have confidence that as Queenslanders we will continue to be able to manage not just the pandemic but grow our economy, ready for the arts to absolutely prosper into the future. But I'll hand it over to John to give you some more details about the theatre itself.
Thank you, Minister. Thank you, Premier. As the Premier and the Minister have said, this is an exciting time for us in the arts. To see this building coming out of the ground means that we are set for a new decade. This fifth venue will allow the local companies to grow out of the Playhouse and into this new 1,500-seat venue. We're not just building a fantastic piece of architecture, we are building a wonderful instrument that producers will be able to fine-tune and present some of the best work in the country. One of the things we've learnt about COVID is our over-dependence on shows coming from Sydney and Melbourne. What this theatre does, it's a game changer. We now become a hub for being able to create work and to drive it down on a secondary touring circuit down through Central Australia. We'll be able to go from Brisbane to Toowoomba, down to the Canberra, into Adelaide, and create a secondary circuit. From there we can go to Perth and New Zealand. The work that we're seeing coming through here really excites me. The opportunity to invite more international companies, the opportunity to see more national presentations, and also to have the local companies who are fighting for space to be able to grow here is quite timely. The other wonderful thing that's happened in the last 10 years is we've seen the way that Queensland audiences have embraced the performing arts. And it's timely that the Premier and the Minister have backed this project, because it's the opportunity that shows that not only will our attendances surpass 1.5 million in a year when we normalise, we will get to 2 million attendances in a year. That's extraordinary attendances for any centre our size. So it's a great time to be in the arts. Thank you.
When's opening night?
Well, we're fine-tuning that now, and as the Premier and the Minister have said, sometime in 23 we'll be having an exciting opening.
Originally for the end of 2022, what's delayed it further?
I beg your pardon?
The project was due to be finished at the end of 2022, what's delayed it further?
Well, we're travelling on time, but we've always aimed that we would open the theatre in 23. There's work that has to be done once the building is completed for us to actually have all the mechanisms working. This theatre will have a state-of-the-art flying system, an electronic flying system, something that we at QPAC have never had. So it's going to take us a little bit of time to master that.
And a question for the Minister. Are the budgeted already blown out by 25 million? What's it at now?
Thank you. That I'll just correct you on that. It hasn't blown out, but certainly what we've seen in terms of the final design plans, I was very pleased to be able to be supported by Treasury and by the Premier to ensure that we made sure that this was going to be a state-of-the-art theatre. That's why the Queensland Government has committed $150 million to this project, and QPAT, the actual trust, is committing some $25 million to be able to secure exactly the kind of facility that we want to propel Queensland forward. And I'm very proud to be able to have been able to secure that funding for this particular project. It's going to make all the difference.
It's new money?
No.
It's not new.
No, it's not new. It's not a new announcement. No.
Office said the increase from 150 million to 175 was due to an air conditioning system and COVID-19 measures. Is that not true?
So obviously this project is going to be a state-of-the-art theatre, something that every Queenslander can be proud of, and of course as we continue to support the arts industry in this state, it'll be an important part of our story. We know that we see in the arts and cultural sector some 92,000 people supported as in jobs, and that it supports about $8.5 billion to our economy in Queensland alone. That's why the $150 million dedicated by the Palaszczuk government is an important part of being able to move this project forward. As you've heard from John, the CEO, it is absolutely state of the art. We will have elements at this theatre that you'd expect anywhere else in the world. It'll be absolutely putting Queensland on the map internationally.
So that late 2022 deadline of date for the opening had only ever been for construction being finished, not an actual opening
that's right.
date?
So at the end of 2022, we were anticipating that we would see construction completed around that time, and that there was always a commitment that we would see the new theatre open to the public in 2023. And I know plans are already underway to make sure that that is going to be an absolute spectacular. Anybody who's of my generation will remember back when QPAC first opened and we saw the new theatres. I was in grade 12, I think, or 11, and that was absolutely spectacular. Everybody was involved. It was a real community effort and connection to what would be a fantastic investment of a generation. This is exactly the same. This is the next generation of investment that we're going to see in the arts, and this theatre will make all the difference. And I'm looking forward to 2023 when we have our official opening. Well, obviously there'll be a whole heap of other technical issues in terms of the actual QPAC and the staff getting used to all of the technical absolutely state-of-the-art elements to the staging, etc. They'll need to get used to all of that so that's fully functioning and that we can see actual productions in there. But we're expecting that it'll be in early 2023. Sorry?
How many people are currently on the social housing register?
So obviously we distribute that information and that data is made available publicly, and you can access that on our open data sets. In September 2020 there were just over 24,000 people on the social housing register, which is a very important tool in terms of being able to support people who are seeking assistance when it comes to housing. That of course doesn't mean that they are not supported in every possible way, from housing, rental schemes, etc., as well as social housing products.
Lydia is going to come. We might get rid of the microphones and the lectern and get a few pictures and then call it a day. Right, would you want to drink the water?